Welcome to the Welsh Wound Innovation Centre. This is the first national wound healing centre in the world, and those of us who are involved in it are very proud that we've been able to bring the National Wound Healing Centre here in Wales. The centre is designed to coordinate clinical, educational and research activity focused in the area of wounds. This centre provides state-of-the-art care. We can provide education and training for clinical staff that is second to none, and we can undertake a wide range of research activities that leads to better understanding of the problems of wound healing and better therapies for patients. This is a 15,000 square feet facility that has a mixture of clinical rooms, teaching facilities and offices and admin support.
We hope that any patient who develops a wound in Wales will be reaching the right clinician as soon as possible and therefore achieving the best outcome for them as early as possible. Clinically, the centre is very well set up so that we can care for our patients in firstly a very safe environment for them, but also for our nursing staff. So we've ensured that the equipment we have is of the highest calibre. It also allows us to give patients the opportunity to try products in a safe environment. It also means we are bringing together clinical expertise. So we've got a team of very well trained research nurses who will be a constant focus, and they get consistent care from people who are both confident and competent in what they do.
One of the key steps to make patients with wounds have good care is to produce an educated, trained and motivated clinical workforce. In our dedicated clinical training suite, we have state-of-the-art audiovisual aids. We can take these students through the theory and the knowledge gaining education and then take them on to practicing skill-based activities in the clinical areas.
What we're aiming to do is bring together clinicians from the whole of Wales, but also from the rest of the UK and maybe internationally.
For me, from an educational perspective, it would mean that wherever you live in Wales, that you are going to get healthcare personnel that are trained and educated to the same level so that the care you receive is optimal, whether you're in a nursing home, a residential home, acute district general hospital or a community hospital or under the care of the district nurses, that the education can support standardisation of care delivery, and that to me would be a marvellous achievement.
This is a purpose-built building for clinical trials, and we intend to run academic studies, commercially funded studies and evaluations from the centre. Research
is a key element of what we will do, because without research we will not improve standards. Without research we will not understand how best to use products and therapies that exist. Without research we will not develop better treatments and better therapies for patients with wounds. It is important, if not essential, to have a national centre that coordinates this range of activities, all of which are important for patients with wounds.